Good afternoon, everyone. Thank you for joining us today. I'm Susan D'Antoni, the Executive Director of Montgomery County Medical Society, collaborating with MedChi to offer this 22 legislative session overview and Grassroots Skills workshop. We are getting some feedback. There we go. So we are recording this call and we will be posting it on our website as well as MedChi's website and pushing it out to the members so that they too can enjoy and appreciate this overview that we are doing today. A few housekeeping items before we begin. We have muted participants at the beginning of this call for sound quality purposes. To mute or unmute yourself over the phone, press *6. On a PC, Alt+A. On a Mac, Shift plus Command plus A. We welcome your questions. You can also submit them via the chat feature. We'll have a full Q&A after the presentation today. And today's program is an opportunity to provide an overview of how the lawmaking process works in Annapolis. We're going to discuss MedChi's 22 legislative agenda. And we're going to provide you with key grassroots skills and tools as physician advocates. Today, we will also be addressing specifically prior authorization, Medicaid, and the loan repayment program, which are three focus areas in MedChi's legislative agenda this year. So now we'll begin our program. We're very fortunate to be joined today by Steve Wise, who is a partner with Schwartz, Metz Wise, MedChi's lobbying firm, and he's graciously agreed to present at this session. Mr. Wise has more than 20 years of experience lobbying in Annapolis and extensive experience advocating on healthcare regulatory matters. So Steve, we thank you for being with us today, and we're going to turn it over to you now.
Thank you, Susan. Appreciate everybody joining. I would anticipate that running through the slides takes about 15 minutes or so, maybe 20, and then happy to entertain any questions or comments you may have afterwards. As Susan said, I think looking at the attendee list, I know most of you. I'm Steve Wise with Schwartz, Metz Wise. We are the lobbying and legal firm for MedChi, and we handle all legislative lobbying and regulatory work for the association, for the society. We're going to walk through today a number of things, and this is just sort of an outline of what we'll cover. We're going to talk about the legislative session, which is set to start next week, and we'll talk specifically about some of the legislation that's going to be the subject of MedChi's focus in that session. And we're going to talk about some grassroots skills because the society is very dependent on its members being able to reach out to legislators to lobby, but it's important to know how to do that. So that the grassroots skills section of this presentation will hopefully give you some tools to be able to be your most effective at that. As an overview of the session, the General Assembly meets annually for 90 days every year, and it begins on the second Wednesday of January, and this year that falls on January 12th, which is this coming Wednesday. Runs for 90 consecutive days, weekends included, and they can extend that, but that rarely happens. They're usually ready to go home, and I'm usually ready to quit after 90 days. There are 141 delegates in Maryland, that's the House, and 47 senators in the Senate, and they represent 47 legislative districts. There are 3 delegates for each legislative district and 1 senator. In the House and in the Senate, each legislator gets assigned to 1 standing committee. In the House, there are more standing committees than in the Senate. But every bill that gets filed gets sent to one of those committees for review. And that's somewhat unique to Maryland because every bill generally gets a hearing if it's timely filed. And that's not true in every state. We typically have around 2,500 bills that are introduced between the House and the Senate each session. Now, some of those are what are called cross-filed bills, meaning the same bill, one in the Senate and one in the House. but they still get a hearing in each chamber to start the process. For MedChi, most of those bills go to specific committees that we focus on because most of the bills are worked on there. In the House, that's the Health and Government Operations Committee, the Appropriations Committee, and the Judiciary Committee deals with all of the medical malpractice and liability laws. In the Senate, because they only have 4 committees, the work is spread out more. So we're in front of all 4 of the main standing committees there. The important thing to understand about the committees is that is where the work is done. When a bill goes there, it's in very raw format, probably needs a lot of amendments, needs a lot of understanding by the committee members. But the committee, typically in the House, that's about 23 members, and about 11 or 12 in the Senate, they will dive into the bill and try to figure out whether it's good bill, bad bill, whether it can be fixed if it has problems. But the committees are where the work product is created before it's sent back to the full Senate or the full House. So as I mentioned, the General Assembly convenes next week, and some people think it's just kind of mayhem for 90 days, and that's not entirely wrong. It certainly can be, but there is a schedule to keep things moving along. And that includes a bill request guarantee date, which comes just about a week after session begins. So if you're a legislator and you want to have a bill considered, you have to request it. And that basically means either providing the language to the bill drafting department or meeting with someone in bill drafting to explain to them what you're trying to accomplish, and they help put it into bill form. About that same time, the governor has to introduce the budget bill, and the budget committees then begin sort of dissecting that and holding hearings on different aspects of it. And that continues the whole way through the session. By February 4th, those bills that the legislators requested by the 18th will have to be introduced. A lot of times legislators will get bills drafted. They may decide that it's not ready for prime time and they choose not to put it in. But if they want to put it in and they choose to put it in, they need to have it in the House by February 4th and in the Senate by February 7th in order for it to be guaranteed to get a hearing. Anything that comes in after that can be sent to what's known as the Rules Committee, and typically bills that get sent there either run into trouble because of timing or because they never come out of the Rules Committee. If they do come out of the Rules Committee, they're then sent to the Standing Committee that will review them. But by the time they get there, they typically have such a full agenda already that they don't have time for bills that come in late. Once bills come in, they get a hearing, they get worked on by the committees. But in both chambers, by March 21st, if that bill is going to be treated as a timely bill by the opposite chamber, it has to be passed to that chamber, the opposite chamber, by March 21st. There's only 3 weeks left in the session as of March 21st. So take, for example, a House bill that is passed out on March 20th, that then gives the Senate 3 weeks to look at that bill before the session comes to an end on April 11th. So that crossover date is a date by which it's really a funnel. And while you start out with this many bills at the beginning of session, if they don't make that crossover date, it's pretty much a dead bill. They're not going to get further consideration if they didn't get over to the opposite chamber by that date. And April 11th is a day many of us look forward to because that is the end to the madness. Many of you maybe, well, some of you probably aren't, but I'm old enough to remember a Saturday morning cartoon which talked about how a bill becomes a law, and this chart kind of reminds me of that. But each bill gets 3 readings per chamber. The first is when it's introduced, which is really pro forma. It just gets read by title across the floor of the House or of the Senate. It then gets sent to the standing committees, which we just talked about. And if the committee chooses to vote it out favorably, it gets read back on the floor a second time, typically with amendments. It may also get an unfavorable report, in which case it still gets read a second time, but in deference to the committee deciding unfavorable, that's usually the end of the road for the bill. If it is a favorable report with amendments, it'll get a vote on the floor of that chamber, but that again is somewhat of a pro forma vote. There will be discussion of the amendments that the committee has recommended. But then the third reading is where the bill is in its final format, where all the amendments are made part of the bill and someone can really read what the full focus of the bill is. And that's a simple up or down vote. If it clears that, the same thing then happens over in the opposite chamber. And if there are differences, once both chambers have looked at it, the bill can be sent to what's called a conference committee, which is 3 members from each chamber. And many a bill die in a conference committee because they can't agree. On the other hand, if they do work it out, it goes directly back to the floor of each chamber for an immediate vote. And then bills that pass both chambers, of course, go right to the governor for his signature. One interesting thing about Maryland, certainly a governor can veto a bill. And in most states, there's what's known, and at the federal level, as a pocket veto. If the executive does not sign the bill, it doesn't become law. In Maryland, the governor can allow things to become law, but not sign it. So we have what's referred to as a pocket passage law. It's important to know if you're going to be involved in the legislative process and talk to legislators about bills to be able to read and understand what a bill does. Most people think when a bill comes in, it's writing an entirely new section of law, like reading a new book. And that is not the case in most circumstances. Typically what is happening is somebody is trying to change some existing law. You can imagine after hundreds of years of existence as a state that Maryland has a lot of subject matter already addressed in its statutes, but a lot of times people want to change what is already in the statute. And so they do that by putting in a bill. And this is the first page of a typical bill. This is from 2017, actually the 2018 session. And you can pick up a number of things here just by looking at the top portion of the bill. First of all, every bill has a number. And there's a Senate Bill 30, but there's also a House Bill 30. They probably have nothing to do with each other. The number really is just the order in which it came in, and the House keeps its numbers and the Senate keeps its numbers. This particular bill, if you look at the top left, there's a line that says SB 1037/17. So even though this bill is introduced in the 2018 session, that tells you that it was also introduced as Senate Bill 1037 in the 2017 session. And so it must have failed in the 2017 session because it's being reintroduced in the 2018 session. Senator Ramirez, who is no longer in the Senate, requested the bill in October prior to the 2018 session. It was read across the desk of the Senate on January 10th, 2018. That's the first reading. And then it was sent to the Judicial Proceedings Committee. The Judicial Proceedings Committee voted it out favorable. That's what that means. And the Senate ultimately adopted the bill. Notably, on this bill, there were no amendments. Otherwise, it would say favorable with amendments. Just below that, you'll see the chapter. Each bill that becomes a law, if it's passed and adopted by the governor, receives a chapter number. And then you see the title of the bill. Every bill has a title, and in Maryland, that title has to reveal the full extent of the bill. We have a very, well, I don't know that it's unique, but not many states have it. We have a one subject rule in Maryland, and that is that legislation cannot deal with more than one subject. Obviously, subject can be in the eye of the beholder, but the courts have interpreted that relatively strictly so that you can't pile on 10 different subjects into a bill, for example, here that's entitled Healthcare Malpractice Qualified Expert. You couldn't suddenly put an environmental piece of legislation attached to this. And that's very helpful because when you see a title, it does give you a pretty clear indication that you're dealing just with that subject. In a lot of states, you'll see all kinds of crazy things get amended on to any type of bill that is in motion. Fortunately, we don't have to deal with that. Another thing to understand about bills is what is being done by the use of different symbols in the bill. In this case, very simply, this is a bill that dealt with the Board of Physicians. And years ago, they changed the number of members from 21 to 22. And so the law as it existed when the bill came in said the board shall consist of 21 members. Well, obviously, to raise it to 22, you need to strike the 21 and make the number 22. When you see brackets like you do around the number 21, that tells you that if the bill were to pass, that part of the language comes out and the bold portion is what would replace it. So you can have entire paragraphs that are bracketed out or pages that are bracketed out. So whenever you're reading, you have to be very conscious of not only what's being added to the law in bold letters, but you have to be conscious of what's being taken out by the brackets, because that will be gone if the bill passes and the bold language will take its place. Here you have an example of a page of bold language. Again, this is making some changes in the Board of Physicians law. All of the bold language was new. This was a bill that adopted the criminal background checks for physicians. It sets forth the things that the board has to consider once it gets a criminal background check back as to whether or not a license should be granted. And there was an amendment made by the committee while it was considering the bill. And that amendment is the words, the nature of the crime. The way you know that that's an amendment is it's bold language because it's new, but it's underlined so that you know when the bill came in, the bold language was in the bill, but the underlined language was added by way of amendment. So brackets tell you that language is coming out. Bold language tells you that it's new language being added, and underlined bold language tells you that it was added during the process by way of an amendment. So you read a bill. Then once you understand the bill and you want to set out to communicate with your legislators, there's a few things to keep in mind, and we're going to go over those. This picture is of former U.S. Senator Arlen Specter from Pennsylvania. And you can see a gentleman there who's yelling at him and pointing at him. And as I mentioned there, that's really not a good way to communicate. We want to be a friendly face. As you might imagine, legislators are more interested in talking to people who they can have a calm, patient, reasonable conversation with than they are with somebody who's just going to yell at them and tell them that they're wrong. So a few do's of effective communication are to have an ongoing relationship with your legislator. That's something that's built up over time. You can't call a legislator in March when they're about to vote on an important bill, not having any type of relationship with them and expect to get a return call or to have a lengthy conversation about a bill. This is something that's built up over the course of time. Think of it like your neighbor. You don't have to talk to them every day, but the more you talk to them, the easier you get along and the easier it is to work through issues that may arise while you're neighbors. You don't go knock on their door when you have a problem and expect to have the same result as if you talked to them for 10 years. Get involved early in the legislative process. Again, we have bills that we know are going to be important this session. It's a lot more important to establish communication with the legislator and let them know that you care about that bill now in January than it is on April 8th with 3 days left in the legislative session. And most importantly, going back to our initial point, work on bills is done in the committee. So it's important that you know what committees your legislators that you have relationships with serve on, because they tend to focus most on the bills that they have put in and the bills that they're dealing with in their committee. And if the bill you want to talk to them about doesn't fall in either one of those categories, they're not going to be as familiar with it. Excuse me, I'm going to take a drink. When you do speak with them, you want to identify the subjects that you're going to talk about. Just let them know House bill number, Senate bill number, amendment, so that they can kind of dial in right away. And a lot of that information is available on the General Assembly website. So maybe while you're talking to them, if you're doing it virtually, they can pull up the bill or the amendment and you can talk to them about it. Typically, if MedChi has asked you to reach out to them to talk about a particular bill, there's talking points or an issue brief involved. But you shouldn't just speak from that. You should lend your personal experience to the issue. Otherwise, it sounds like you're using stock talking points. Kind of limit what you're going to talk about. Don't talk about everything that's being considered by the General Assembly. And again, put your thoughts into your own words. Excuse me. Few don'ts of communication. Don't threaten. Don't say, you know, I'm not going to support your campaign if you don't do this. Those things usually backfire. Just make your arguments. Do it in a respectful manner. And most times you'll feel very positive as a result of the conversation, and so will the legislator. Always tell people, I've been in a million legislative hearings and people try to draw comparisons to other things. Don't do that, because you just don't know in a room full of 23 people, or even to a legislator that you don't know, they may not agree with your comparison. And all they're going to remember is what you compared the issue you wanted to talk about with them to. All they're going to remember is the comparison that you made that they didn't agree with. Stick to the issue. Keep it pretty straightforward. MedChi has a process for determining what issues are going to be important. And those are really twofold. We have a House of Delegates meeting in the fall. Resolutions are voted on to call for legislative action. And then also issues come to through legislation that we have to react to. And that's the job of the Legislative Council. And they review every bill that we flag that relates to healthcare that may impact upon physicians. This year, we have 3 main bills that we'll be working on, but there will be tons of others. These are just priorities that we're already focused on. One of those is Medicaid parity and ensuring that Medicaid E&M codes are paid at the same rate as Medicare. And this is extremely important to access through the healthcare for folks in the Medicaid program. If the program doesn't pay well, physicians don't participate, and then there's no physicians to see patients. We've worked on this for years. Maryland has one of the best Medicaid payment rates of any state. We're around 93% of Medicare right now, and we're trying to get that to 100. We have spent a lot of time over the last 10 years working on prior authorization reform. A number of years ago, we spent several years getting a bill passed that was one of the more fundamental reforms in this area anywhere in the country. But there's more work to be done. And we had a resolution passed at the MedChi House of Delegates this fall calling for additional work to be done. So we will be supporting legislation to continue to work to streamline prior authorization. We're also going to be working on Maryland's Loan Assistance Repayment Program, which is a program for physicians who agree to go into underserved areas for a period of 2 years. The problem is the only source of the funding for that has been through physician license fees, which we think is a terribly sort of singular approach to funding an important program. So while license fees, a portion of license fees will continue to go to that, we're calling on the General Assembly to devote general fund money to that. And that helps us get the maximum federal match for that program. The number of loans doesn't come close to meeting the demand. We clearly have a physician shortage, and this is one of the most effective ways to address that problem, because if you ask any medical student what their number one concern is when they come out of medical school, it's the debt that they carry, which is close to $200,000 on average. And if they're not going to make money in primary care, they tend to go to specialties, as we all know. And this is designed to provide a benefit and a meaningful difference to Marylanders by helping physicians who want to be in primary care stay there. So people often ask, what can I do? You can serve on the Legislative Council. You can participate in your components lobby days. You can contribute to the Maryland Medical PAC, which is a committee that reviews campaign contribution requests and determines whether those folks are doing things that are good for physicians or not, and determines whether to make contributions. Get to know your delegates and senators. Don't wait till March to do that. Do that at all times of the year. Attend their fundraiser. Ask them to come to your practice or your hospital. And contact them when MedChi asks you to on legislative alerts. Sometimes there is strength in numbers, even if you don't know the delegate or senator. If you can put a call into their office and say, I'm asking you to support House Bill 1 or whatever it may be, that does make a difference. And as many of you on the call know, MedChi has a great legislative action center where our issue papers, talking points, positions on bills, and other information is all available at any time, including going back to past sessions. You can see what we've done. It's very useful. So just to review, we talked about the session, what's coming up, what the dates are. Hopefully we've given you some help on how to talk to legislators. Don't hesitate to reach out to Chip or Jean or Susan or Carissa with questions. One thing I always tell people who say, well, I don't need, I don't have any control over what they're doing down in Annapolis, or who am I to weigh in on that? There's a phrase that applies no matter whether you're a physician, you own a liquor store, you own a construction business. You better pay attention to what's going on, because if you don't get into politics and understand it, you may find yourself out of business. So with that, I thank you, and I'm happy to answer any questions.
Thank you so much for that excellent presentation. I think another way to say that is, if you're not at the table, you're on the menu, right?
That's right.
So that's another quote that I've heard. And then, of course, all politics is local. And so, we appreciate your instruction and overview this morning. I would appreciate you just briefly addressing 3 areas. These are certainly MedChi's legislative priorities that you went through, but I would ask you, what do you see coming forward on scope issues, on tort issues, and then how does the continuing pandemic, how is it going to play out in this legislative session, since we're now in the second legislative session affected by the pandemic? So yeah. I know that's a lot in one question, but could you please address those?
No, all good questions and important areas. Scope-wise, even though the session doesn't start until next Wednesday, legislators are allowed to file bills in advance of the session. I went through those yesterday, and there's probably 10 or 11 bills already that deal with scope issues. Physician assistants, nurse practitioners, and a handful of others, all making changes to what different health professions can do, can't do. So we're going to be dealing with all of those. And that's not unusual. It just seems like this year we're going to have a lot more than usual. Podiatrists, last several years, they've had a bill to be able to be called podiatric physicians, which MedChi has worked against and which we killed. But I don't know if we're going to be able to hold that back this year. We need everybody's help on that. So that's an example of scope legislation, which we deal with every year. You asked about tort. So MedChi spends an awful lot of time dealing with bills that relate to medical malpractice cases and liability of physicians and hospitals. Those can take a variety of forms. They can deal with liability during the pandemic. They can deal with liability and even criminal sanctions of people who act out in emergency rooms. They can deal with expert witnesses and how much time can an expert who's brought in to testify against a physician, how much time can they spend as an expert? We don't want professional witnesses running around. We want doctors who actually practice. All those things are the subject of legislation. And, we often butt heads with the Maryland trial lawyers who are the plaintiff's lawyers. And they have no shortage of things they want to change about our system. And we go head to head with them on an annual basis on those types of things. This year, there will be some changes proposed in that regard, but just to be very direct about it, it's an election year. It's highly unlikely that the legislature wants to pick a side on what are very difficult issues when you have physicians on one side and sometimes patients on the other. So I don't expect any major changes there, but I've been wrong before and it can happen again. Your final question, Susan, about the pandemic and session. You are right. It will be the second full session that we've been impacted by this, but I'll also remind people in 2020, that session was actually cut short for the first time in history because of the pandemic. It had been the hope of the Senate president in Maryland up until this week that they would be able to do more things in person, like have actual hearings with witnesses in the room. He had to walk that back on Tuesday or Wednesday of this week. Those hearings will, as they were in 2021, be all virtual. And in their case, the Senate president said, I'm making that the rule through February 11th in hopes that the world has gotten better by that time and that we could revisit it and maybe have more things in person. The House has been a little more guarded and said, we're going to do things virtually for the whole 90 days. My hope would be that in February, if things do look better and the Senate makes a change, that maybe the House would too. But we are preparing ourselves for a session with really no in-person lobby days, no receptions where we like to have physicians meet their legislator and spend some time with them. All of those, whether it be a hearing, a reception, or any other contact you're going to have is probably going to be by phone or through a Zoom meeting like this for at least the first 30 days and potentially the entire 90 days. So that I mentioned in talking to Susan and Carissa earlier, I don't like that. That's not my style, but that is what we have. So that's what we have to work with. As a lobbyist, we have a phone full of cell phone numbers of legislators, and we use that, but it's not my preferred method of communication. It's just what we have to do for now.
Well, it certainly isn't our preferred, but I think there are some advantages. It is more convenient for physicians as well as for legislators to meet us virtually. And we have their attention when they're in the Zoom room, if you will. Right. And so I think there are some benefits. I would hate to see it all go away when COVID is less of an issue, but I'm sure we'll work our way through it. So at this point, I'd like to invite any other questions that you might have of Steve about the legislative process or MedChi's priorities. Does anyone have any questions?
This is Victoria. I have one question. Is there a limit to the number of bills that a senator can sponsor?
Well, normally, no. But given some of the difficulties that the virtual nature of the session has posed. They have imposed last year and this year a requested limit of 30 bills in the Senate. I think it's 30, might be 20. Now, that is not a hard, fast rule. And at the end of the day, the Senate president can't stand in front of the hopper where bills get dropped and say, no, Senator, I'm not letting you drop that bill. But they have asked them to prioritize, partly because of the pandemic. But I will tell you, in addition to that, there has been ongoing discussion generally, even outside the pandemic, encouraging senators, this has not taken place in the House yet, but encouraging senators to reduce the number of bills that they put in, because there is a feeling that there are so many bills to get through that the Senate ends up spending time getting through the bills rather than working hard on some of the more important ones. So they're trying to encourage senators to dial their efforts in, reduce the number of bills that they put in. But again, that's really just a request at this point. There's not a hard, fast rule on it.
Thank you. That was really informative. I want to add, I learned a lot.
Good.
Well, great. Any other questions that you have for Steve? Well, Steve, you're a rock star. You and your colleagues, we really appreciate you being there, whether you're doing it virtually or in person.
Thank you.
We really appreciate your expertise and your commitment to MedChi and the physicians and their patients. And we appreciate your committing your time today to do this. We will be putting a link on our websites and pushing this out to our physicians to encourage them to be better constituents going forward. Also, I would just encourage all the physicians that may hear this that get involved in your component society, and they have maybe virtual lobby days this year, but hopefully in person in the future. Also, as Steve said, the MedChi Legislative Council, if you have an interest in that, please let MedChi or Montgomery County Medical Society know, and we will facilitate that. So we just want to remind you also that both on MedChi as well as Montgomery County Medical Society's websites, we have incredible resources for COVID. We're continually updating those. Testing sites, which we understand is a huge issue right now. And so we would encourage you just to take a look at that on a regular basis. Also, Dr. Haft is having his Wednesday calls, which are incredibly informative and timely. If there's something good to be said about Omicron, it's that it's the lesser of two evils, and it's not as bad as Delta. And it's the information he provided on Wednesday, the slide set will also be on our websites. So on that note, we thank you very much for joining us. Thank you again, Steve, and we look forward to your active participation in the upcoming legislative session. So thank you very much.
Thank you.